Hello everyone. In this video, we are going to see about physiology of blood. Contents of this seminar: introduction, composition, function, plasma proteins, red blood cells. In red blood cells, we are going to see about morphology, properties, fate of the RBCs, functions, variations in number, size, and shape, hemolysis and fragility of RBCs, erythropoiesis, hemoglobin, ESR, ECV, and anemia. Coming to the introduction, blood is a connective tissue fluid in fluid form. It is called as fluid of life. It is red in color, and specifically arterial blood is scarlet red, and venous blood is purple red. Volume is about 5 liter. In newborn, it is around 450 ml, and in female, it is 4.5 liter, and it is about 8% of the total body weight. pH of the blood is 7.4 and is slightly alkaline. Specific gravity is of about 1.052 to 1.061. Viscosity of the blood is 5 times more viscous than water. Coming to the composition, blood contains blood cells, which are the formed elements, and a liquid portion called plasma. Blood cells are red blood cells are erythrocytes, white blood cells are leukocytes, platelet cells, platelets are thrombocytes. Plasma is a dark colored fluid which contains 91 to 92% of water and 8 to 9% of fluids. The serum is a clear dark colored fluid, oozes out from the clot, contains all other constituents except the fibrinogen. Serum is the plasma without fibrinogen. This is the composition of the plasma, which composed about solid of 7 to 8%, water of 92 to 93%, and a gas. In solid, organic substances and inorganic substances are present. In organic, plasma proteins, amino acids, carbohydrates, fats, internal secretions, enzymes, non-protein nitrogenous substances, and antibodies are present. In inorganic substances, sodium, calcium, potassium, magnesium, bicarbonate, fluoride, phosphate, iodide, iron, copper are present. In gas content, oxygen, carbon dioxide, and nitrogen are present. Coming to the functions of the blood, the nutrient function, respiratory function, excretory function, transport of hormones and enzymes, regulation of water balance, regulation of acid-base balance, regulation of body temperature, storage function, and defensive function. Coming to plasma proteins. Plasma proteins are serum albumin, serum globulin, which is of three types: alpha, beta, and gamma, and fibrinogen. Normal value of plasma protein is about 7.3 gram per deciliter, and normal albumin globulin ratio is 2:1. Into the origin of plasma protein, mainly from reticuloendothelial cells of the liver, spleen, bone marrow, disintegrating blood cells, gamma globulin from B lymphocytes. Variations in plasma proteins cause hyperproteinemia and hypoproteinemia. Functions of plasma proteins: coagulation of the blood, defense mechanism of the body, transport mechanism, maintenance of osmotic pressure in the blood, regulation of acid-base balance, viscosity of blood, ESR, suspension stability of the RBC, production of trypsin substances, and reserve protein. Coming to red blood cells, erythrocytes are non-nucleated formed elements of the blood. Red color of RBCs is because of presence of hemoglobin. Normal value of RBC is, in male it is around 5 millions per cubic mm, and in female it is around 4.5 million per cubic mm. Morphology of RBC. Shape of RBC is disc shaped and biconcave, that is dumbbell shaped. The size size of RBC in diameter, it is about 7.5 micron and 2.5 micron at the periphery and 1 micron at the center. Nucleus and all other organelles are absent. Properties of RBC. Rolex formation. This RBCs pile up one above another like pile of coins is accelerated by the globulin and the fibrin. Specific gravity of RBC is about 1.092 to 1.101. Packed cell volume. Volume of RBC is expressed in percentage. This is hematocrit value and suspension stability. Fate of RBC. The lifespan of RBC is about 120 days after they are destroyed in reticuloendothelial system. Destruction occurs mainly in spleen, which is known as graveyard of RBCs. Where 10% of senile RBCs are destroyed. That is 0.6 gram per deciliter of hemoglobin released and 0.9 to 1.5 milligram per deciliter bilirubin is formed. In this flowchart, there is we are showing the fate of RBC. Destruction of RBC in spleen releases the hemoglobin. From hemoglobin, iron and apoferritin, globin, and porphyrin are released. Iron and apoferritin are converted into ferritin, and ferritin is converted into stored and reused content. Globin is converted into protein pool and stored and reused, and porphyrin is converted into bilirubin, which is excreted. Functions of RBC. RBC transports oxygen from lungs to tissues and transports carbon dioxide from tissues to lungs, and buffering action in the blood and in blood group determination. Variations in RBC. In number, increase in RBC, which is polycythemia, can be seen in physiological conditions such as age, sex, high altitude, muscular exercises, emotional conditions, increased environmental pressure after meals, etc. And pathological condition, red bone marrow malignancy, polycythemia vera, emphysema, congestive heart disorder, Ayerza disease, and poisoning. Decrease in RBCs are seen in high barometric pressure during sleep and pregnancy. Variations in size are microcytes, macrocytes, and anisocytes can be seen. In variation in shape, renation, spherocytosis, elliptocytosis, sickle cell, and poikilocytosis can be seen. Hemolysis and fragility of RBC. Hemolysis, breakdown of RBCs and liberation of hemoglobin. See, fragility, susceptibility to hemolysis or tendency to break easily. Fragility is easily broken. Conditions when hemolysis occur, hemolytic jaundice, antigen antibody reactions, poisoning by chemicals or toxins. Hemolysins are agents that cause destruction of RBCs. Erythropoiesis. Process of origin, development, and maturation of erythrocytes is the erythropoiesis. Site of erythropoiesis are in fetal life, mesenchymal cells of the yolk sac, mesoblastic stage, which is in the first trimester, in liver, spleen, and lymphoid organ, which is hepatic stage, which is in the second trimester, in red bone marrow and liver, which is in myelin stage, which is in third trimester. In adults, red bone marrow of all bones up to 20 years of age are sites for erythropoiesis, and all membranous bone and ends of long bones after 20 years are the sites for erythropoiesis. This is a diagrammatic representation of the erythropoiesis. This hemocytoblast is converted into proerythroblast. The proerythroblast is converted into early erythroblast, which is converted into late erythroblast, followed by normoblast, reticulocyte, and finally erythrocyte is formed. Factors necessary for erythropoiesis are general factors: erythropoietin, thyroxine, hemopoietic growth factors, vitamins, mainly A, B, C, D, and E. Maturation factors: vitamin B12, intrinsic factor of castle, folic acid. Hemoglobin formation factors: iron, copper, cobalt, nickel, vitamins, and proteins. Coming to hemoglobin. Hemoglobin are iron-containing coloring pigment of the RBC, which consists of protein called globin and iron-containing pigment called heme. Molecular weight of hemoglobin is about 60,000 daltons. Normal value of hemoglobin is 14 to 16 gram per deciliter. In male, it is around 15 gram per deciliter, and in female, it is around 14.5 gram per deciliter. Functions of hemoglobin are transport of gases, buffer action, etc. Types of hemoglobin are adult hemoglobin and fetal hemoglobin. Abnormal derivatives are carboxyhemoglobin, methemoglobin, and sulfhemoglobin. Synthesis of hemoglobin starts in the pro-erythroblastic stage. Heme portion synthesized from succinyl-CoA and glycine in mitochondria and globin polypeptide chain in ribosome. Destruction of hemoglobin is done in reticuloendothelial system, particularly in spleen. Hemoglobin is degraded into globin iron porphyrin. Erythrocyte sedimentation rate at which erythrocytes settle down is the erythrocyte sedimentation rate. If blood mixed with an anticoagulant allowed to stand undisturbed on vesicle tube, RBC settle down due to gravity. Two methods are commonly used: Westergren methods and Winthrop's method. In Westergren method, tube of 300 mm long marked from 0 to 200 mm from above downwards, which contain 1.6 ml of blood mixed with 0.4 ml of 3.8% sodium citrate. The ratio of 4:1. Tube placed vertically and left undisturbed. Reading taken after 1 hour. Normal value is about, in male it is 3 to 7 mm in 1 hour, and in female it is 5 to 9 mm in 1 hour. Winthrop's method, tube of 110 mm long, marking on both sides 0 to 100 for ESR, 0 to 100 to 0 for PCV. 1 ml of blood is mixed with an ADDA. Tube left undisturbed for 1 hour. Reading taken after 1 hour. Normal values in this Winthrop's method are: male 0 to 9 mm in 1 hour, and for females it is 0 to 15 mm in 1 hour. Variation in ESR increases in males during menstruation, pregnancy, that is from 3rd month to the parturition, and tuberculosis, malignant tumors, liver diseases, and decreases in allergic conditions, sickle cell anemia, polycythemia, and severe leukocytosis. Packed cell volume of RBCs in blood expressed in percentage, that is hematocrit, blood mixed with EDTA in Winthrop's tube, centrifuged at 3000 rpm for 30 minutes. Reading noted. RBCs are packed at bottom. White buffy coat, zone between RBCs and plasma, that is the PCV value. Normal value for males is 40 to 45%, and for females is 38 to 42%. Variations in PCV: increases in polycythemia and dehydration, and decreases in anemia, cirrhosis of liver, and pregnancy. Coming to anemia, blood disorder characterized by the RBC count, HB count, and the PCV. Classification of anemia is mainly based on morphological classification and etiological classification. Morphological classification of anemia: in normocytic normochromic anemia, size of RBC is normal and color of RBC is normal. Normocytic hypochromic anemia, size of RBC is normal and the color of RBC is less. Acrocytic hypochromic anemia, size of RBC is large and the color of RBC is less. Microcytic hypochromic anemia, size of RBC is small and the color of RBC is less. Etiological classification: there are types of anemia based on etiology are hemorrhagic anemia, hemolytic anemia, nutrition deficiency anemia, aplastic anemia, and anemia of chronic diseases. Hemorrhagic anemia causes may be chronic hemorrhage or acute hemorrhage. For hemolytic anemia, causes may be liver failure, renal disorder, hypersplenism, burns, infections, drugs like penicillin, poisoning by lead, isoagglutinins, hereditary disorders, etc. In nutrition deficiency anemia, iron deficiency, protein deficiency, vitamin B12 deficiency, folic acid deficiency. Neoplastic anemia, bone marrow disorder is the cause, and anemia of chronic diseases, rheumatoid arthritis, tuberculosis, and chronic renal failure are the cause. Signs and symptoms of anemia: skin and mucous membrane mainly involved, has and needs are involved, cardiovascular system is affected, respiratory failure or can be seen, causes problem in digestion and metabolism, kidney, reproductive system, and neuromuscular system. Thank you.